next Sunday, June 14th at 8:45. It won't be our usual service in the sanctuary since many changes are being made to lower the risk of spreading the COVID-19 infection. Because of the changes, I feel comfortable in my decision to be present in person. These changes include the following. The service will be held outside in the courtyard. It has now been shown that the major way the virus is spread is through airborne droplets. In outdoor areas, any airborne droplets quickly dissipate and are unlikely to infect others. Enclosed areas, such as poorly ventilated bathrooms, pose a higher risk, and I would encourage members to minimize coffee intake prior to the service, use the bathroom before leaving home, and if necessary, wear a mask if you do use the church bathroom. Hand sanitizer will be readily available. Bring your own sanitizer is also helpful. During times when we might be closer than 6 feet, such as entering or leaving the area, attendees will be encouraged to wear face masks. Wearing a face mask mainly protects others from you, and I consider it common courtesy to do so. I have been closely following the daily infection and hospitalization rates in Austin. The infection and hospitalization rate for the greater Austin area has remained fairly stable despite the easing of the initial stay-at-home orders that we were observing. With the easing of the restrictions, which began over a month ago, many of us have been venturing out a little more to stores, restaurants, barber shops, and hair salons. Thankfully, it has been my observation that most people have continued to wear face masks and practice social distancing during these outings. I suspect these precautions have greatly contributed to the lack of a marked increase in infections during the reopening. In my opinion, attending an outdoor church service with precautions in place is a low-risk activity. That said, I'm not suggesting that everyone should attend church in person. At this point, anything we do outside of our home has some degree of risk. We're all weighing these risks and making judgment calls about our activities. If you have chronic health problems that place you at a higher risk or are anxious about venturing out, I would encourage you to stay home. Watch from the automobile in the church parking lot or view the 1045 online service instead. I look forward to seeing familiar faces from a distance and hope for a future when things get back to normal and we can all worship together without fear. Thank you.